Hello, everybody. My name is Andrea. I did my project with Alexa and Lacie. We did our project for the HRSA and BHWET program that CalU is offering. We did our case study on our client. His name is Chad. So a little bit about Chad. He is our 17-year-old client. He is currently enrolled in a group home through Adelphi Village. He presents with safety concerns. He has been displaying high levels of physical aggression toward others and presenting a safety risk toward the staff, other peers, and himself. He is presented with a suicide risk while having self-harm history. So throughout our presentation, some questions to consider would be, what are the clinician's role each step of the way? How do they collaborate with one another? What are your responsibilities as a clinician, and what is this client experiencing? How is it impacted by a rural and medically underserved community?
So Chad, he's a 17-year-old client, but he is turning 18 very soon. He currently resides in Adelphi Village's care in a group home-based setting. I am the staff member at Adelphi Village, in which I meet with Chad on a weekly basis for individual and group counseling sessions. But during an individual counseling session, he had expressed that he is having homicidal thoughts about others, specifically peers and other staff members. So with this being said, we discovered it more with Chad, and he had also stated that he was having visions on how he planned to hurt staff members and peers. So a little background on Chad and his placement with Adelphi Village. He has been in Adelphi's care for about 4 months now. Chad has a history of suicidal ideations, as well as having an attempt of a suicide attempt in the past. He has a self-harm history as well. So with this being said, when he was brought into Adelphi's care, he was ordered a psych evaluation upon arrival to the facility. During this evaluation, it was concluded that he hears voices often. He often feels as though others around him is plotting against him, and also becomes very irritated easily and suddenly. While in Adelphi's care, he continues to meet with a psychiatrist monthly at Adelphi. He, during his first psych evaluation, he was diagnosed with bipolar disorder as well as conduct disorder. The psychiatrist also noted that he was showing early onset symptoms of a potential schizophrenia disorder, but it was not formally diagnosed at this time, mostly due to the age. Over the last 30 days, it was seen that Chad, his aggression and these unsafe thoughts and behaviors were getting significantly worse, and there was a potential for an increasingly more unsafe environment for the staff members as well as the peers around him. So he was admitted into an inpatient facility. This facility is known as Western Psychiatric Hospital for inpatient services, where he will meet with Lacie.
Okay, so when Chad was admitted to Western Psych, he was put on the child and adolescent bipolar services floor due to his bipolar symptoms that he was showing. So he will be mainly supervised by Milieu therapist staff. So some roles and responsibilities of a Milieu therapist are to provide group therapy that is scheduled, as well as different Milieu activities throughout the day. And this therapy is mainly BBT and CBT. And there will also be self-compassion, anger management, expressive arts, and safety planning groups to make sure that Chad has the skills that he needs whenever he is discharged. Another role is a responsibility is to maintain a safe and therapeutic Milieu environment. So this involves monitoring clients in regards to their safety concerns on a 5 or 15-minute basis. Chad would most likely be on a 5-minute monitoring due to his suicidal ideation and his self-harm concerns. The Milieu therapist also resolve any crises that arise on the Milieu. We encourage peer interaction between the clients, as well as encourage the client's engagements throughout the group therapy and the different Milieu activities. And there will be one-to-one clinical intervention provided to the clients as needed. And then we're also assisting the clients with their daily living activities as needed. And lastly, we serve as a liaison between the client and other members of the client's treatment team. So that could be the nursing staff, the main psychiatrist, and their assigned social worker. And we're also serving as a liaison between the client and the family when needed. The collaboration. So as a milieu therapist, I would be the one who's spending the most time with the client and seeing most of their behavior. So it is important that I assess this behavior and pass it on to the rest of the treatment team. So I'll be attending bi-weekly treatment team meetings, as well as documenting any important client behavior throughout the day from each shift and communication logs that are going to be shared with the rest of the staff before the next shift. Milieu therapists, nursing staff, the psychiatrist, and the social worker are all going to work together to determine what would be best for the client post-discharge. In the inpatient setting, the social worker provides the client with these resources, and often they are the ones who contact other organizations and secure client appointments and placement. So the social worker would ultimately be the one who's going to contact Andrea and her organization.
So through that referral, Chad was referred to the Chestnut Ridge Counseling Services. He was ultimately placed with the Assertive Community Treatment Team. We offer a full support service program consisting of case management and treatment for people with severe and persistent mental illness, such as bipolar, schizophrenia, and etc. We provide comprehensive and intensive outpatient treatment in addition to rehabilitative and support service. So our goal is to assist people with serious and severe mental illness and help them to live their daily life in the community and maintain as much of a normal current status to society as possible. We serve them repeatedly. So if they come in and out of the hospital, they come back to us. We just pick up kind of where we left off, redo their paperwork, and start over. Some of the people we serve have serious mental illness and repeatedly experience hospitalizations, incarceration, substance use and abuse, psychiatric emergencies, homelessness, the list goes on. Our goal is to integrate those people into the community, providing them adequate support through clinical, rehabilitative, and support staff expertise within one team. So after receiving the referral from Western Psychiatric, the client will have his files reviewed. He was deemed eligible for the ACT team due to his mental health diagnoses, his previous hospitalizations, and the fact that he is now 18 years old. He will begin the program by meeting with the program manager, the psychiatrist, and the lead nurse. They will fill out all of his necessary paperwork, go over the expectations, complete an evaluation on him, and he will set his treatment goals at that time with them. Afterwards, he will meet with the psychiatrist. He will go over all of his medications. At that time, they will decide, based on his status, how they feel that he will do with taking his medications appropriately. So we may be delivering medications once a week. We may be delivering 3 times a week. We may be delivering 5 times a week. Due to his past with homicidal ideation and things like that, we will begin by doing a daily medication delivery to him so that he does receive contact each and every day. He will be also offered to attend a drug and alcohol group. It's not required that he attend these things, but again, given his history, it will be strongly encouraged. If he does choose to decline, he will still meet individually with a drug and alcohol therapist each week. In addition to that, he will be assigned a case manager, which will assist him in setting up all the basics to living in the community. They will help him schedule appointments, budget his bills, provide him transportation to the appointments or to the grocery store or anything like that, so that he can maintain that normal home life as best as possible. He will also be assigned a mental health therapist, which would be myself. I will meet with him once a week. That could change based on the status of him Same with the drug and alcohol therapist. We could up it to like twice a week. 2 to 3 times is about the max, but most of the clients are once a week. We will talk about his stressors, any concerns, any progress in the community, needs, etc. And we will continue to monitor his suicidal, homicidal ideations, and continue working with that as the needs arise, and hope to keep him in the community as best as possible. We will be able to communicate just by having a morning meeting we do each day, so that every staff member stays up to date on his needs.
Okay, so how is Chad's mental health treatment going to be impacted by him living in a rural or medically underserved community? Firstly, there is a lack of inpatient and behavioral health units in hospitals in the area that he lives in, which is mainly Fayette County, especially units that are focused with adolescents. Western Psych currently has the only adolescent bipolar focused inpatient unit that is in Pennsylvania. There's also a lack of group homes that are present in rural counties, so he does have to make the travels to Adelphi Village whenever he was placed there. And then Chestnut Ridge ACT is one of the only services that is focused for his specific diagnoses, which was bipolar disorder, and he was showing signs of schizophrenia. Especially in Fayette County, these tend to be pretty sparse. And that is all. Thank you all for watching.